Welcome everyone. Thank you for joining us today for the session that we're calling Moving Forward on Endometriosis Care in Scotland. I'm Emma from Endometriosis UK. We're just going to give people a couple of minutes to join. So thank you for that. So we'll, as I say, we'll just have a couple of minutes while I ramble on a little bit, and as people join, once we've got the bulk of people in, we'll then do introductions and we can see how they go. It's really nice to see everyone joining. We've already got at least half the people in very promptly. You are a very organised group. Thank you very much. We will give people a few more minutes, a couple of minutes, and then we will carry on going forward with things. So that's great. Whilst we are waiting for people to join, I will just do a couple of housekeeping rules. If that's the right word on Zoom, I don't know what they're called, Zoom rules. There is a Q&A function that you'll find, depending on whether you're on a computer or a phone. It'll be in a slightly different place. On my computer, it's at the bottom. And you can ask questions in that, and do ask questions if you've got any. We will be having a Q&A towards the end of the session, and we will if we can't get around to everybody's questions, we will take them away and see what we can do afterwards. We won't have your details to email them to you, but if there's themes and things, we can get those answered. Just to remind people to ask general questions that apply to general people. We can't answer specific individual questions about your specific endometriosis or medical situation. So please, if you could keep questions general, we'd really appreciate that, and we can answer them. So we have got a good chunk of people in. We'll just wait another couple of minutes, and also waiting for I know Monica's done an amazing sprint right up from the chamber, is that the right word, Monica, I think, to ensure that people are coming. But I know that Maree Todd, who's going to be speaking, was also in the chamber, and will be coming on up as well soon. So if you just bear with us 1 or 2 minutes, that would be great. So thank you to everyone who's joining. So my name's Emma from Endometriosis UK. Lovely to be speaking to you all today. As I say, we're just waiting a minute or two as we wait for people to join. So welcome to everybody. This is our session that we're doing, hosted with Monica, on moving forward on endometriosis care in Scotland. I'm absolutely delighted to be talking to a Scottish audience, because as we've talked about with some of you before, there's some really positive things that the Scottish Government are doing in order to reduce diagnosis times and improve care for endometriosis. There's a long journey ahead of us, but the right things are being said and the right things are starting to be done. So we'll be hearing about some of that soon, and looking at how some exciting work that's coming on. What we're going to be doing today is Maree Todd, MSP Minister responsible for women's health in Scotland, is very kindly joining us in what I know is a very busy schedule, and will be talking to us about the Women's Health Plan and endometriosis, obviously, particularly. Monica Lennon, who's MSP convener of the cross-party group on women's health, among other things, and a long-time supporter of endometriosis community. Thank you, Monica. We'll be talking about the view from the Scottish Parliament. I'll touch on the common challenges that we're hearing from those with endometriosis in Scotland. Brittany Gibson, who leads a support group and is patient representative, will also then be giving her personal experience of living with endometriosis, an experience that she has as a support group leader, hearing many stories from those throughout Scotland. I will just double check where we are with letting everyone in. Maree Todd is going to be joining us shortly. As I say, parliamentarians are busy, I know that. Monica, can I do that evil thing of asking you to start, but if Maree joins, then I'm going to maybe segment in depending on how long it takes. Would you bear with me, and is that okay if you do that on that one?
Hi, Emma. Yeah, I'm happy to step in. Oh, here is Maree, right on cue.
Right on cue, Maree. Thank you so much for joining us. Maree's just joined. Maree, thank you so much for joining us. Sorry about the confusion earlier. Loving that you're on brand with colour. What more could we want on that? I was just saying what a joy it is to be speaking in Scotland, because it's so great to see the work that's being done in the Scottish Government to really actually make a difference to those with endometriosis. And, you know, as things come to fruition, I genuinely think that care in Scotland will be better than the rest of the UK and many parts of the world, if not leading. And so it's going to be really interesting to hear about the work. So Maree, without taking any more of your time, you were going to talk to us about the Women's Health Plan, if that's okay.
Thank you very much, Emma, and apologies about that little technical glitch. I'm having them all this last week. I've had enough of this pandemic life. And I'm grateful for your words there about what Scotland's doing. I mean, I hope we lead the way, and I hope the rest of the UK follows pretty quickly, because I don't want just women in Scotland to benefit and have their lives transformed by the work that we're doing here, but I would really like that to filter out right across the UK. So my name's Maree Todd. I'm Scotland's Minister for Women's Health. I'm delighted to be here tonight, and I want to thank you very much for inviting me to this event as part of Endometriosis UK's Action Month. Very grateful to be here with fellow panellist Monica Lennon. Our determination right across political parties to improve the care and support for women with endometriosis is absolutely crucial in our raising awareness and our success in Scotland. I'm very much looking forward to hearing from Brittany Gibson tonight. I recognise the huge importance of listening to people with lived experience. To have your voice heard and for others to listen to what matters to you is just vitally important in getting it right. And I'm looking forward to listening and learning from your voice and others in the audience tonight. I'm going to digress a wee bit, so it would be very remiss for me to talk to a whole room full of women, a virtual room, without taking a moment to think about what's happening in Ukraine and the women and children that we are seeing fleeing their homes right now from war and violence. And our capital city, where myself and Monica are at the moment, is twinned with Kiev. And our country is already home to several thousand Ukrainians who are valued members of our communities. It's absolutely shocking and devastating to see almost 3 million people from Ukraine, the majority of whom are women and children, having to flee their country because of war and violence, a week after we've celebrated International Women's Day. So officials in my team are working at pace with key partners, including COSLA and the Scottish Refugee Council, to put in place the necessary arrangements to make sure that people coming from Ukraine who want to come to Scotland receive the support that they require. And we've got a long history in Scotland of welcoming people of all nationalities and faiths, including people who seek refuge and asylum from war and terror elsewhere. Now, nobody knows what the next few days, weeks or months will bring, but I know that all of you here tonight want to talk about the health inequalities faced by women in our country, and I want us to do so freely. But I am absolutely sure that you'll all join me in sending support and solidarity to the women and girls of Ukraine who have just shown unimaginable strength since Russia's invasion of their country. Here in Scotland, the health of our women and girls is absolutely a key priority for the Scottish Government, and I am sure that many of you are aware of the ambitious Women's Health Plan published in August 2021. The Women's Health Plan underpins actions to improve women's health inequalities by raising awareness around women's health, improving access to healthcare for women, reducing inequalities in health outcomes for girls and women, both for sex-specific conditions and in women's general health. And to develop the plan, a whole range of experts from different specialties were brought together to work on women's related health issues. The work was informed by lived experience. So we did a lived experience survey and a series of lived experience engagement events to ensure that women's voices and experiences were absolutely central to the development and implementation of the plan. And I'm sure that several of you who are here this evening were involved in shaping that plan. And I want to take the opportunity to thank you for your contributions. We're here tonight to talk about endometriosis, and it's a condition that we know only too well has a devastating impact for so many women in Scotland. It's estimated that the condition affects 1.5 million women in the UK, but we often hear about the difficulties in diagnosis due in part to the diverse symptoms, but also the lack of awareness and the lack of non-invasive diagnostic procedures. I absolutely recognise that the symptoms of this condition can be debilitating. It impacts on all aspects of women's lives, relationships, work, education, and mental health. I'm proud to be able to say that the Women's Health Plan has actions to improve access for women to appropriate support, to speedy diagnosis, and to the best treatment for endometriosis. And we're absolutely committed to delivering on these actions and to take the necessary steps forward to improve health outcomes for women. Now, in order for us to deliver on those actions set out in the Women's Health Plan and to develop a clearer understanding of the current care offered for endometriosis in Scotland, the Scottish Government funded Endometriosis UK to understand the provision of and the barriers to care for endometriosis in Scotland. And those 4 recommendations will help us in our goal to make a meaningful difference for women, raising awareness of the NICE guidelines and implementing that consistently across Scotland, highlighted that collaborative working is key. We are committed to facilitating education and relationships between healthcare services, to ensuring that consistent and informed care is provided throughout Scotland. And the report also concluded that significantly more needs to be done to raise public awareness and to ensure that menstrual education has the most up-to-date, informative and supportive learning for our young people. So we in Scottish Government are really grateful for the research undertaken by Endometriosis UK. We are working to deliver on those recommendations in line with the actions in the Women's Health Plan. Now, I think everyone here today will join me in recognising that there are many barriers to receiving timely support and a diagnosis. And we've been taking positive steps to begin to reduce the diagnosis time and ensuring the best possible advice and support is available for women throughout that diagnostic process. So you've told us that it's important to distinguish between a working diagnosis and a confirmed diagnosis. And we want people to achieve that working diagnosis as soon as possible so that they can access appropriate care and treatment. We know that this requires the symptoms of endometriosis being identified quickly. And by raising awareness and improving education in menstrual health, we're committed to achieving this. The recently published guideline from the European Society of Human Reproduction and Embryology focus on earlier presentation and to support primary care to establish a working diagnosis. And this will have the greatest impact on the individual's quality of life, and it echoes our policy priorities. We recognise that it's vital that we improve care and support throughout the whole diagnosis and treatment process, and that some of those with endometriosis might not require a laparoscopy. Last week, we published our National Workforce Strategy for Health and Social Care report, which has committed to continue to support and enhance the knowledge and experience of our workforce. And I'm also pleased to see within the report a commitment to implement the Women's Health Plan actions to support women working in the NHS. For people who require and wish to proceed with confirming a diagnosis, we're focused on reducing the time, the waiting time for laparoscopies. The NHS Recovery Plan, with £1 billion of funding, will support an increase in inpatient day case and outpatient activity to address backlogs. Whilst being mindful of the impact the pandemic continues to have on health boards, we will gather local data to help us to understand the immediate pressures around waiting times for endometriosis care. Now, to achieve an early working diagnosis, one of the main actions is to raise awareness of endometriosis, and that will help to ensure that young girls and women know when to go to their GP and they can be more confident in presenting their symptoms. Hearing women say that they are not being listened to, even when painful periods impact on their day-to-day life, their fertility and their mental health, is just not acceptable. And the voices of the 3 women in our NHS 24 lived experience film, in which Brittany Gibson appears in, gives a heartfelt insight into living with the condition. We are very grateful for the time given by all the volunteers in the film and for being willing to share their experiences. To provide accurate and up-to-date information to people and to healthcare professionals, we've been working with NHS Inform to update the endometriosis and menstrual health pages. And this will also show the lived experience video and provide links to pages which will help support people looking for more information about the condition so that women know that they're not alone. As our children learn about their bodies and what they can expect in the coming years, awareness is also critical at school age. So menstrual health, including endometriosis, is included in the Scottish curriculum. And we're working with the National Resource for Relationships, Sexual Health and Parenthood to provide additional resources to Scotland's teachers, parents and carers. We've also been working very closely with Endometriosis UK and have funded a £15,000 project to raise awareness and to support those awaiting diagnosis. We're actively looking to sponsor projects that will connect with the community to better understand what further action we could be taking and will allow us to evaluate the improvement prior to obtaining a working diagnosis. And events like this tonight are incredibly important to help to raise awareness and to provide opportunities to speak openly about women's health conditions. Awareness of endometriosis doesn't stop with the public, you'll be very pleased to hear. Awareness needs to be improved in healthcare settings, and we've been working with the Centre for Sustainable Delivery to develop an endometriosis care pathway that will individualise treatment by improving earlier intervention, support within GP practices and streamline referrals where required. Now that pathway provides expected timescales and in particular a 6-month period to trial hormonal treatments before being referred to a gynecologist to begin conversations about further treatment and diagnosis options. And I want to thank again Endometriosis UK for your involvement in developing that pathway and producing a supporting diagnosis information leaflet that will help women and enable them to understand the process, give them some assurances at a very early stage and ultimately empower them. To help ensure that the pathway is adopted consistently and that there's support available for healthcare professionals, we're going to be working to deliver more opportunities for training and developing networks to coordinate and to advise on endometriosis care. And that will help to provide equitable access to support and care for women right across Scotland. I think those networks are key. We need to ensure that the education of endometriosis isn't aimed solely at those who might have the condition, but at everyone. And those who don't have the condition have to be able to recognise and support their friends, their family, their co-workers. And that recent Westminster Hall debate focusing on supporting people with endometriosis in the workplace was a welcome discussion. And we're very grateful again for Endometriosis UK's continued endometriosis friendly employer scheme, which supports employers in law and best practice. We're encouraging employers to adopt flexible working practices by funding Flexibility Works, and that will hopefully also help in supporting those with endometriosis. Now, we recognise that reducing the time to diagnosis alone, it's really important, but it is not by itself an effective measurement or demonstration of improved health and well-being outcomes. Because endometriosis is a long-term condition, we recognise that supporting women's mental health is as important as timely clinical treatment, and that's been raised throughout the development of the Women's Health Plan. Improving mental health is a real priority for the Scottish Government, and in February 21 we announced an extra £120 million for a mental health recovery and renewal fund. And we're ensuring that mental health policy reflects the impact of endometriosis by improving accessibility of services so that the right help at the right time and in the right place is always available. Now, by listening to lived experience accounts and clinical views, we are well aware that more needs to be known about this condition to improve experiences for women. We are absolutely committed to commissioning further research into the underlying causes, the diagnosis, the prevention, the treatments, and a possible cure. So in closing, I am really grateful to have the opportunity to speak at events like tonight. I'm really proud to be Minister for Women's Health. And I hope you've heard from me tonight just how committed I am to making a difference for women with endometriosis. We really enjoy working with informed partners like Endometriosis UK. We trust that you'll keep us right and hold us to account on progress. Don't be afraid to hold truth to power. You've heard how much work is already well progressed and how much more we have to do, but we can only do this with the support and guidance of all of you here tonight. So I want to thank you again for inviting me to speak, and I look forward to hearing from all of you very much. Thank you.
Thank you, Minister. And isn't it really, I mean, I find it really lovely to actually hear all the things that I'd like to be saying coming out of the mouth of a minister, probably much better than I would say them. But I think there's some real positive opportunities for Scotland, as we've said, to lead the way and show the rest of the UK how to do it, the rest of the world how to do it. And we will, I can assure you, be working with you, but also raising issues that come up and seeing what progress is made. Could I hand over so what we're going to do now for those who just joined is Monica's going to speak, I'm going to speak briefly, and then Britt's going to speak, and then we're having a Q&A as well. So can I please hand over straight away to Monica, if that's okay?
Thank you very much, Emma. It's like a musical Zoom chair, because initially I was supposed to be in the chair and in Parliament mucking around with the decision time tonight, and then Maree, you arrived just in time because I was going to have to wing it a little bit, because I was looking forward to coming in after Maree, because there is a lot going on. There is a lot, I think, that is positive and encouraging, but I suppose what we'll need to see going forward from the government is your homework as you go along, because I think we all really share the ambitions and feel really positive, but we just need to see where that progress is being made, and I think transparency around that will be really key, given that we have 14 health boards across Scotland and they're all perhaps at a different place as well. But thank you, Emma, and thank you, Endometriosis UK, for having me along tonight. I was looking back at my diary from March 2020, before I had heard of Zoom, and I was really lucky to be able to host you in Parliament, and we had an in-person event to mark the Awareness Month. So a lot has changed, but unfortunately for people living with endometriosis, life has got tougher in the pandemic. There's no way of trying to sugarcoat that. So for anyone living with a chronic condition, with a long-term condition, you know, effectively the NHS was put into emergency measures, and many of your treatment options were taken away. So that has been really, really tough. And nothing that we can say on a call like this tonight will make that any better, but I want to make that clear from the beginning. But, you know, Maree, as the Minister, has set out some of the positives, and I think it's because of Endo UK, because of patient reps, people speaking out, that we do have a women's health plan in Scotland. So I think you'll have to give yourself a pat on the back for that. But again, it's about where we can start to see some real progress. We have this really important commitment to reduce the average diagnosis from 8.5 years down to 12 months by May 2026, the end of this Parliament term. But again, we're going to have to, you know, on a very regular basis, hear how that is going. And I think it would be great to hear regular updates in Parliament from Maree and her colleagues about where we're making progress, and importantly, where we're not making quick enough progress, so that we can try and work together to speed that up. tonight, Emma, I'm really struck by the banner behind you, you know, end the silence, end the pain, and end the isolation. That's the one I don't know if you can point at another one. And I think, you know, these are sort of calls to action that we all really have to try and live up to. So ending the silence, well, all of you are doing that, you know, by raising your voices, sharing your experience, helping to tackle stigma, to get good positive media coverage. That's been really, really important. I think the BBC research that was done, which was a couple of years ago now, I think that really brought home to people in Parliament who've not followed Endo UK closely that, you know, endo is really common. It affects 1 in 10 women. It also affects some trans men and non-binary people. It can affect teenage girls as well. But what really, I think, hit me in the face is the fact that around half of the people who responded to that BBC survey said that they had experienced suicidal thoughts. So Maree is absolutely right. This is not just about physical health, it's also about mental health and well-being. Where I think we do need to make progress, and I think maybe other nations in the UK are a little bit ahead, is around that education that we had Maree talk about. Mental health and wellbeing education could be a real game changer. I know that Endo UK have done loads of campaigning on this. I think that's an area where we do need to go further and faster. I think the role of employers is also really important. That's why I would encourage other people, if they're not already signed up to be an endo-friendly employer, to go ahead and do that. It's something I'm really proud of myself. And we do have new MSPs in Parliament, and it's something that we all should be doing. Recently, it's been great that we've had a members debate led by Rachel Hamilton, MSP, and again, that's helped to raise the profile and help to end the silence. But I think we all feel frustrated that we need to see more action. In terms of ending the pain, well, really we're looking to government to lead the way on that, to properly resource our health boards. I think there was a comment in the Q&A about access to specialists and to surgeons. These are real issues that the government has to respond to. So there are workforce challenges that need to be addressed. And in terms of ending the isolation, on that, I would like to say that we have to recognise that there are different challenges in different parts of Scotland. There's people on the call tonight, including Kirsty Campbell, who are really strong at talking about what's happening in their area, particularly in Caithness and the Highlands. So we have to look at the additional challenges around the distance to hospitals, access to public transport. All of these things can make life even harder. So I'm going to draw my remarks to a close because I think I'm getting to say something at the end, Emma, and I think that is my time up. But early diagnosis obviously is important. Better pain management, yes, that is an urgent issue. And to echo Maree, yes, right treatment at the right time, that is an ongoing challenge. As the convener of the CPG on Women's Health, I'll continue to work with Endo UK and MSPs across the Parliament, but really it's about everyone feeling that they can join our group, and we'll work with colleagues in Westminster too. So if you haven't joined the CPG already and you're on the call tonight, please feel free to email my office and we'll be happy to have you involved. But I will hand back to you, Emma.
Monica, thank you very much. And I think as I would echo that the Women's Health Group that Monica leads has been really central to raising issues like endometriosis and others. So do join and do hear what's going on for women's health and endometriosis. In terms of moving forward, I agree completely with Monica's saying. Is obviously we're hearing absolutely the right things from the Minister and others. The Women's Health Plan, I think, is great. I'm biased. I was involved in one of the working groups, but I do think there's some really great stuff in there. I think that is then put in a context of a really challenging situation around access because of because of COVID and other things. And there will be some tough decisions to be made around resourcing. But what we need to focus on is trying to get as quickly as we can to all those with endometriosis, seeing the right person at the right time and accessing treatment so they can move forward and be helped with their condition. I'm going to hand over to Britt, if that's okay. Some people have asked about the video that Maree mentioned earlier that Britt was in, and you can find that out if you just go on NHS Inform. If you Google NHS Inform endometriosis, there on the front page, you will see that. So that's just to answer that question. Anyway, could I please hand over to you, Britt? That would be great. Thanks.
Yes, thank you so much, Emma. And thank you for having me here tonight and being a part of this panel. It's great to obviously get the opportunity to tell my story and the struggles that I've faced, as well as obviously voice, the stories of those within the support group that I lead here in Glasgow. So to give a bit of background about myself, my period started very young. I was 11. I remember the exact moment in school. My seat was covered with blood, and I basically got up and ran to the nurse's office and phoned my mum, and that was me, petrified. And at that time, for myself growing up, it was very not too different from it is now, in the sense that it has a stigma around it. You didn't really talk about it. It was, you had a hot water bottle and you took some paracetamol and you kind of got on with it. As I got older, around 15, 16, my periods got significantly worse. I had debilitating pain where it would make me so nauseated that I would be sick at school. I had been on the floor in dance class and at school, just curled up in a ball because I couldn't manage the pain. That progressed as I got older. And again, at that time, it was just all down to bad periods. My mum didn't know any different because it wasn't really educated at that time about other gynae conditions that it could be. So why would you think that it would be anything else if that's what you've been told? Then around 18, I started seeking greater advice about my periods because they started making it so that I couldn't really do, my certain activities around my cycle. And it really was throughout from 18 up until I got my diagnosis at 29 that I had gone through being completely gaslighted by medical professionals. I was told it was in my head. I was just the young girl who was stressed at uni, had been tested for other things, had got it down to, where it was a matter of, just try to relax, which is probably the most patronizing thing that you could say to somebody who is literally in debilitating pain, where 2 to 3 weeks out of the month, you can't live your life. Your uni takes a hit. Your work, if you are working, is also impacted. So for myself at 18, like I said, I had obviously started seeking more medical help for it, went on several different forms of birth control. Nothing really, helped or changed anything, and I still continued to struggle. The pain continued to get worse. It was about 24, 25 that my sister, at the time who was studying to become a vet, was listening to me basically vent to her about how much pain I was in. I was pacing the floor, grabbing, my stomach and my pelvis, just because it was one of those pains that you can't sit still. You rock if you sit still, but you can't help but move because it's excruciating. And I was talking to her and she was asking me about my symptoms, and she said, "Have you heard of endometriosis?" And I literally said to her, "Endo what?" And I had no idea what it was talking about. But it goes to show, my sister, who's studying to become a vet at this time, was the one who first told me about it. And I think that says something about the health system and healthcare providers and the education offered to them. So going forward, I still continued to suffer for several years. And then at the age of 29, about a month before my 30th birthday, I got referred for surgery finally, and I was diagnosed with stage 3 endometriosis. And it was a very bittersweet moment for me because I was happy, as weird as it says, to finally know that I was right. That sounds strange, and very few people can actually fully grasp what that means. But I was also upset and just didn't know how to process my feelings because I've just been diagnosed with a chronic illness. So it very much is a bittersweet thing where for a brief moment you have that, oh, I was right, and that weight's lifted off your shoulder, but then it sinks in and realizes, wait a second, this although I was right, this is going to impact my entire life. So I had surgery for that in February 2020. I then needed a second surgery in September 2020 because my pain continued to get worse. So it was suspected that I still had deeply infiltrating endometriosis at that stage. So I'd gotten an MRI and then went for excision surgery. And it was during that surgery that I came out the other end and found out that I also have adenomyosis, which is where the lining of the womb grows into the muscle. And it creates, for me, it creates labor type contractions, heavy bleeding. It's also known as kind of the evil twin, if you will, of endometriosis. And the only way to cure that is through a hysterectomy. And several people within the group that I lead reiterate the exact same thing. A lot of them do have it, some of them don't, some of them have PCOS. So it's the thing about endometriosis as well is that it is often paired with something else. So building that knowledge and breaking that stigma of talking about it is important. But one of the things that I did want to bring up was kind of what the community voices now within, Glasgow, and I think reiterates it across Scotland, is that, we're so happy to see that there is the Women's Health Plan, that there are things, like menstrual well-being put into place. But the problem at the moment is that none of us are really receiving effective communication for our care. We don't know where we are on the waiting list. A lot of members are sitting here in excruciating pain. Their work has been affected. Some may have been let go because they couldn't, continue on working. Some people may have had to drop out of college, and they're sitting here with this pain affecting their mental health, their overall well-being, and they're not having clear communication from, whether it's the health board or the hospital. Some are getting discharged early without any follow-up, and they have no idea who to contact. The same can be said for people who maybe get a diagnosis and then their follow-up gets changed and it gets cancelled and it gets put back, but they're still experiencing pain. Or the exact same happens for those that are trying to get referred. So what I'd really ask, the minister and Monica, as far as, MSPs and MPs go, the thing that you can bring up is, what can we do now to create consistent communication between all of the health boards? So we have these pathways, which are great, and it's fantastic that we have those, but what can be done at a fundamental level because of a result of COVID, that, these communication pathways, if you will, can become consistent again, because it varies by health board. Members are all over, and with that, they're saying, oh, well, my GP won't refer me because I'm not within Greater Glasgow and Clyde, or some are in Inverclyde and they don't know how if they can have access to the specialist centre. So a lot of people are really pushing that, can we just have that communication, because you're on a waiting list. For some people, it's been probably up to 2 or 3 years and in so much pain, and they're not getting any support while on the waiting list. They're not getting access to mental health resources, which is massive. And they're also not getting up-to-date communication. You can kind of not really manage your pain, but your expectations of your pain, when you know that maybe surgery is going to be 6 months off or 7 months off, because you prepare for it. And I think that that's one of the biggest things that have constantly been reiterated time and time again over the pandemic. And recently, members have gotten in touch to me to say, do you have any idea of if these are moving forward? I'm being told, what one person brought up in the Q&A, access to specialists. So I'm aware of the time. I don't want to continue on, but I think that it's really, really important. If there's anything that you guys can bring up in Parliament and further discussions, please bring up that consistent communication so that something can be put in place now, so that those deadlines that are set out in the Women's Health Plan can hopefully be successful. But if there's no communication, then we're very limited by what we can do.
Britt, thank you very much. Now we are going to start a Q&A, and I'm actually going to start with Britt's question, first to Maree and then to Monica. And we hear this all the time, as Britt explained so eloquently, people just don't know where they are. they don't know if they've been dropped, they don't know what to do, they don't want to bother the NHS, they don't want to get lost. Just wondered what thoughts you had about how can the communication be improved so that patients know what's happening, and also they can get help at that time. They don't have to wait the 3 years before their appointment. Maree, may I ask if you could help us with that?
Yeah, definitely. I mean, I have to say it's a common theme, and it's one I hear with all sorts of chronic conditions, particularly, I mean, endometriosis is one of them, but you can imagine people who are waiting for a joint replacement are in exactly the same boat. So we're working at it. My surgery is full of folk looking for information from the NHS. As a constituency MSP, I'm pretty sure Monica's will be exactly the same. And I work with the local NHS board where I live, so that's NHS Highland, to try to improve that situation. As a minister, I'm meeting with NHS representatives all the time, and most people agree that it's a fundamental right, isn't it, to know, to be given a realistic time scale of how long you're going to need to wait, and to be signposted to help and support while you wait, and to have that explanation of, we'll check in with you so often just to make sure that you're okay and that things haven't changed. If things do change, then please contact us this way. And we're trying hard to get that type of communication the norm, frankly, because I think it would reduce a lot of distress and a lot of energy and effort that's going into dealing with inquiries if the health board was able to be more proactive about that. And generally everybody says, yeah, that's a great idea, but it does, I mean, Monica will be well aware, we've had some communication recently over a letter which she shared with me, which was another medical condition where, the standard of communication just fell well below what I would hope for from the NHS in Scotland, and we're working on it to try to improve that. I think that clarity, even if it's bad news, I think people would rather know a realistic timescale. What can they do to help themselves meantime, and how do we check in with each other whether things are changing? I think those are really important aspects.
Thank you, and we hope that things will progress. Monica, did you want to add anything from your perspective? Thanks,
Emma. Yeah, I mean, I think unfortunately people with endometriosis already have quite low expectations because they've spent, a lifetime waiting to be believed, waiting to get on the right pathway. So Brittany's absolutely right in terms of there are some communication issues that need to be addressed. I think there is a remedy. I think in Maree, potentially we have a strong leader within government who's going to bring together 14 health boards to say, we do need consistency, we do need clear communication, and people need to be treated with dignity and respect, because I've seen in my local health board, people with chronic pain conditions receiving letters basically saying, sorry, there's been delays, please write back and let us know you still want to be on the waiting list. If we don't hear from you by this date, you could be taken off the waiting list. We can't have that. But to be fair to health boards, they are on their knees. So they need to know what resource is coming from government, because we do have legislation in Scotland that gives patients a treatment time guarantee of 12 weeks. And even before the pandemic, it wasn't worth the paper it was written on. So yes, we need to be realistic, but we have a responsibility to make sure that people with chronic conditions like endometriosis can access treatment. If we don't resource this properly, then I fear that the commitments in the Women's Health Plan just won't be achieved. And we're going to look back and have lots of regrets, because Britt has said, in her remarks that, this is about quality of life. People are having to leave the workplace. It's having an impact on education, on relationships, on people's quality of life, and that's what's at stake, and it's not acceptable. So yes, clear communication, but I go back to my earlier remarks about we need to keep coming back to the floor of Parliament and talking about this. We can't just leave it to members' debates, opposition questions. A few times a year we need to get an update from the Minister. And we all love to hear from you, Maree, so anytime you want to come to Parliament, I'm sure you'll have a receptive audience.
Thank you, Monica, for adding to that. And Maree, we look forward to hearing those updates. And I think as you're hearing, people do want to know what's going on, even if they're being told they will have to wait. It's making sure they know what's going on. Just moving on, we have Eleanor Whittam Msp in the audience. Thank you, Eleanor, for your question. And Eleanor's saying that as a new MSP, she's already seen lots of, several harrowing cases of basically women with endometriosis being told they're difficult by their GP or they're being ignored. I mean, I'm sure we've all heard it. You're just a worse, you've just got a low pain threshold, etc., and their impact not being taken seriously. And so the question really around that is about how do we ensure primary care services are fully up to date on this condition so that early diagnosis is available. And Maree might want to mention that. One thing that I'll just say on this is that do you know there's some really great GPs out there who diagnose endometriosis symptoms really quickly, and on the flip side are the other ones, and I think where we need to go is to make sure that it's the norm that people think of and know the symptoms. They're not that complicated, and so I think it's doing that. But Maree, as Minister, I don't know if you've got anything on the training in primary care, especially of GPs.
Yeah, I mean, I think it's really important that there is training available for health professionals and that there is training available for GPs in primary care. I think there probably needs to be training right across the board. And one of the things we're working on, and I said in my introductory remarks, was this network, which I think will be really valuable when it's up and running. So links between primary and secondary care, support available. If an individual healthcare practitioner doesn't have the expertise themselves, they know where to go to get the support that they need. Education is vital, and there are, we'll work hard with NES and other delivery partners to make sure that we improve the quality of education available. I think that consistency, so that work to improve the referral pathways so that there's a real clarity about what needs to happen, when it needs to happen, and what needs to be done before the next step. I think all of those things will really improve the situation. So I think we've got an awful lot of work and train to do that. I mean, one thing I would say, one of the, and Monica touched on it in her response, is that women often aren't listened to, and they are dismissed, and they are told they've got a low pain threshold, or the many other things. And I think, Emma, you said that, the number of reasons why women aren't listened to. I mean, I would argue that there is quite a lot of resource in the NHS already, but one of the challenges and one of the reasons that there needs to be a women's health minister and there needs to be a women's health plan is because we are not a priority, and we face those health inequalities. And I'm absolutely determined to turn that around. And women's champions at health board level will help raise the profile of women's conditions. I mean, it's incredible to me that such a common illness there's so little awareness of it across the board. It's as common as asthma, it's as common as type 1 diabetes, and there's so little awareness and understanding both in the general population and in the medical population. So, I mean, I would say we have a lot to do, but we could hardly fail to make progress because we're starting at such a low bar.
Thank you, Maree. And I'm going to stay with you, if I may. Building what you've just said, one of our questions is around that women are ignored when it comes to menstrual issues, as you've just said. Women of colour are ignored even more. And in the Women's Health Plan, are the issues of intersectionality being considered?
Yes, I would say so. So they are across the board. I mean, I talk about health inequalities as being like a golden thread right through all of the work that I do, because it is often the case that those people who are discriminated against in one aspect of their life are often, exactly as you say, suffer that intersectional discrimination. And yes, we are determined to improve the situation for Black and minority ethnic women, disabled women as well. you know, it's a bit of an eye-opener when you sit down with women with disabilities and talk about how they can access a smear test, you know, and the challenges involved in accessing smear tests. So there are women who are suffering in multiple ways, and we recognise that, and we're determined to improve that.
Thank you for that. I'm just going to answer a couple myself because chair's prerogative. We've had a couple of questions, one from Eleanor Whittam Msp, but also from Kerry around endometriosis that's outside the pelvic cavity. So this is that historically endometriosis has been considered as a menstrual condition and women's reproductive bits condition, I quite often hear, so within the pelvic cavity, but up to 12% of those with endometriosis may have endometriosis outside the pelvic cavity. So that's the diaphragm or above, or below that. So, you know, bowels and bladder count as within the pelvic cavity, but there are other things. And, you know, you get, again, I'm talking about some relatively uncommon cases, but people coughing up blood and things like that. We, Endometriosis UK, believe very strongly it's a big omission in the NICE guidelines, that the NICE guidelines adopted in Scotland as well, only considered endometriosis within the pelvic cavity. The reason for this was that there was no research, unfortunately, around extrapelvic, as we call it, endometriosis. Some research has been done by some of the Royal Colleges, and certainly the European guidelines that Maree talked about earlier also mention it. And from memory, and I'm going to think, we've made representation to the Scottish Government for them to consider including endometriosis outside the pelvic cavity. It's something that it's not something that there's a magic wand to just do it immediately, and some pathways need to be developed and thought out. But there is commitment to look at how that is done in the UK, but also in Scotland, I know as well on that one. And one of the points that Maree also talked about was this working diagnosis versus a different than a confirmed diagnosis. And we've had a question about what is being done to try and make it easier to diagnose endometriosis instead of having to go through laparoscopy, and some questions around that. Now, I'm not a medic. We could have a whole session on this, and we can put a webinar on about it if you'd really like. So we've always said for many years, laparoscopy is the gold standard for diagnosing endometriosis, actually going in and having a look, because as we know, it doesn't always show up on scans. What is happening though, as scanners get like massively better and more technical, and you have people who are expert surgeons trained in scanning, that certain types of endometriosis with a really good scanner and a really good person can be seen on certain scans. And as I was talking to one of the expert scanners at one of the specialist centres just a week, as he said, it takes exactly the same time to do a bad scan as it does to do a good scan. And what we need to do is get the right kit and into hospitals and people trained. Again, there is work being done on that nationally and at European level to look at what can be done. So there is work there, but it's not done yet, and it's still a negative laparoscopy. That's a negative scan doesn't mean you haven't got endometriosis. And at the moment, there isn't a way of picking up all types of endometriosis. So what Maree's been talking about, and I'm not trying to put words in your mouth, Maree, so do say, is that if you wait to say diagnosis that you have to have surgery, you might be waiting for a long time, but also not everybody requires surgical treatment to treat their endometriosis. And so the aim is to get, you know, Britt talks about not ever having heard the word endometriosis despite having multiple symptoms. So we want people to hear the word endometriosis as early as possible in their journey as one of the things that's being looked at, and then to work with their healthcare practitioners to find out if there's a treatment that works for them that isn't surgical, and then to make informed choice about when and if they want to go forward with surgery. So Maree, if I've said anything wrong on that, you want to add to it?
No, not at all. And one of the things I would say is that building in that 6 months of hormonal treatment, I think, is quite an important factor. So what we don't want is for people to drift at that early stage. If that drug treatment hasn't worked for you, we want there to be a clarity around what happens next. And I think that's really important. And on the area of research, I think on the area of diagnosis, I think that's an area where we need to focus maybe some research money, because there, as you say, scanning is just incredible. I mean, I worked as a health professional, I worked in mental health. And in the 20 years I worked in mental health, the biggest progress was not in drug treatments, for mental illness it was in scanning, and in that 20-year period we were able to look inside and look at people's brains while they were still alive and see what was happening inside their brains then. And I think the progress that can happen with scanning will be revolutionary, but we need to focus it on women. You know, we know that it's a man's world and the odds are stacked against us. You know, this is why women, you know, are not getting the research focus. So we need to change that.
Thank you, Maree. And we will be in touch really shortly if you want to invest some money in scanning. I'm sure there'll be a lot of people who'll be interested in that. I'm just looking at the time and we only have 4 minutes left, and Monica's going to be closing for us. There's a lot of questions we've not had a chance to answer. And if it's okay with Monica, Britt and Maree, is we will take those away with us and we'll try and do a Q&A for all the common questions to try and get some answers about things where we can. So thank you all for your questions. And Monica, can I hand over to you to close the event, please?
Thank you very much, Emma. We've only had an hour, but I think it's been a really good event, and hopefully we can continue the conversation. Thank you to you, Emma, and your team for organising this and all the hard work behind the scenes. Thank you to Maree Todd, Minister for Public Health, Women's Health and Sport, not to leave that bit out, for your time tonight and your willingness to answer questions, and I hope take away the good ideas that we've heard tonight. And of course to Britt Gibson, without the patient voice we wouldn't be making the progress that we are making. So thank you to Britt and everyone else who continues to speak out. I think your power individually and collectively when you speak out and tell your story, it is really important. But I think we all recognise that that is exhausting and it can be traumatising. We want to get to a place where we're able to celebrate real improvements on the ground to healthcare, so we can talk about improvements in workforce, in education. I think Maree talked about we live in a man's world. Well, women are more than half the population. We need to really challenge gender inequality wherever it exists, and that very much includes medical misogyny, which really I think is the root of what we're talking about today in terms of the challenges around GPs. Wouldn't it be great if it was easier for women and people with endo to become GPs, to become nurses, to be the health professionals? But right now we're seeing too many people drop out of education, drop out of employment and not fulfill or live up to their potential. So that's what we really need to change, because at the heart of this, it is about health inequality. Waiting times are too long. We're seeing people who can ill afford it turn into private healthcare when they should be able to get the right treatment at the right time on the NHS. Today, we've only had an hour, we've got a few seconds left, but again, it's a thank you to all of you for turning up. We want to make every month of the year Endo Awareness Month, and I think there was agreement, I think consensus, that it would be good to hear more regular updates in the Parliament, to see visible champions in all of our health boards. And I think next time we meet at the CPG to discuss endometriosis, it would be good to have colleagues there from primary care representing GPs, because I think that's an area where we need to see real progress and we need to see leadership also. But we are going to be called back to the chamber soon to vote, Maree and other colleagues, I think Rachel and Alina, who are on the call tonight. So so thank you everyone for allowing me to be your host tonight and for having this event. And I think Britt's literally putting the lights out, so that is the time to go. But please, I do hope to see you at the CPG. You're very welcome. That's an open invitation, and I hope we can all stay in touch. Thank you.
Thank you, and good night, everyone.